Welcome to Rare Living, the podcast where we dive into the unique challenges, triumphs, and realities of life with a rare disease. I'm your host, Giusiana, and each episode, I'll be sitting down with incredible guest speakers, patients, caregivers, advocates, and experts to share powerful stories, valuable insights, and the resources that make navigating the rare life just a little easier. Together, we'll uncover what it means to truly live rare, build understanding, and strengthen our community. So let's get started. Welcome back to Rare Living with Giusiana, where we shed light on the raw, unfiltered experiences of life with rare disease and chronic illnesses. Today, we're diving into a topic that many of us know all too well, but isn't talked about nearly enough: the dehumanizing aspects of living with chronic illness or a rare disease. From the mistreatment by medical professionals to the everyday ableism we encounter from strangers to the lack of autonomy in our lives, all of it chips away at our humanity and our feeling of completeness. So, one of the first places that we experience dehumanization is often within the medical system. You'd think that the people tasked with helping us would understand our struggles, but that's not always the case. One of the most common stories I hear is about doctors dismissing our symptoms, and I've dealt with that myself. For instance, a person with Ehlers-Danlos syndrome might present with severe joint pain and dislocations, only to be told it's just stress, it's in your head, or if they're still young, oh, it's just growing pains. And this invalidation, it can make you feel really invisible. You're not being seen, you're not being heard. And then there's the medical gaslighting. Like, you're going to dozens of specialists. Each one is telling you that there's nothing wrong, the tests are normal, and then only to find out years later that you've been living with a rare and serious condition. It's not just frustrating, like, it's dehumanizing. It's as though our pain isn't real unless it fits neatly into their diagnostic boxes or the common diagnoses. And another aspect is invasive tests. Sometimes they're necessary, often they're necessary, but the process can be so violating. And you have to do them because you need answers, you need help. But procedures like lumbar punctures, like, that's traumatic. And my experience, especially when it caused a CSF leak that the hospital refused to patch for multiple days, I felt like I wasn't human. I felt like nobody cared. Things like catheters, that's traumatic. It's dehumanizing. There's so many procedures that are so invasive, and while they might be necessary, there isn't the understanding, the awareness, the attention to making sure you're comfortable. And a lot of that could be helped, while the experience wouldn't be different physically, it could be helped a lot by doctors putting an emphasis on informed consent. Like, this is what's going to happen, this is what you can expect to feel, this is, all of that. And a lot of times that's not even there. They're just like, okay, this is what we're doing, this is what you need to do, and there's no effort made for patient comfort or understanding. But it's not even just in the medical world. We're not safe from judgment in day-to-day life. How many of you have used a mobility aid, like a wheelchair or a cane, and had someone out in public question you because you don't look sick? Because me too. Sometimes it's just a side eye at the grocery store, somebody judging you. But sometimes there's outright comments like, you're too young to need that, or I had somebody tell me that I should leave the canes for the people who actually need it. And that's exhausting to have to deal with. And just the constant othering, you feel so different. And even, friends and family can perpetuate it, even if it's not intentional. Comments like you're not trying hard enough, or if you just exercised more, you'd feel better. And those comments don't just hurt, they dehumanize us because they're reducing our complex medical issues, our reality of these issues are being reduced to just laziness or a lack of effort. And that's not what it is at all. I think personally, one of the most dehumanizing things that I struggled with was how much assistance I needed. For a while, there was time where I couldn't get up and use the bathroom without help. I couldn't take a shower without assistance. And that that's really difficult. That's really hard. Just the loss of autonomy and freedom and ability, it makes it feel like you're being stripped of who you are. And that's so hard, to have to depend on other people for help with basic tasks like showering or cooking. It's not even just a pride thing. Like, I don't think it's a pride thing for me when I had to have help with that. It's more just a stark, blatant reminder of how much we've lost, like how much I've lost, how much control I lost over my body, how I went from being active and working on a farm and horseback riding and hiking to not even be able to stand up on my own, to not be able to take a shower, sometimes not even able to feed myself. And there's a unique kind of vulnerability that comes with having to say that I can't do this on my own, especially for things like that. And not everybody offers that help with dignity or kindness or understanding. And even if they do, even if you have supportive caregivers and supportive people in your life, there's often such a sense of guilt, like feeling like a burden. Even if everybody's reassuring you that you're not a burden, that they're happy to help, that they just want to help you, that they're there for you, you feel like a burden. And that's not something that I really know how to get past, but it just adds to the struggle and to the vulnerability. And constantly feeling like a burden, it chips away at your self-worth. Even with reassurance, just constantly feeling like I can't do this on my own. I have to rely on people. The financial aspect of, medical bills. It's very, very all-encompassing. Back to the medical procedure aspect and how that impacts your loss of autonomy. Many of us, including myself, feel like just like a lab rat. You're just a case study, especially the people who have the rare diseases. Just being poked and prodded and photographed and constantly asked questions. Sometimes doctors will be like, "Oh, you're rare. Let me bring in my medical students." And that's really valuable for the medical students, but it comes to a point where I just feel like a specimen. I'm not a human being. I'm just a lab rat. I'm just a case study. The doctors are more interested in my test results or my past medical history than how I'm feeling. And it's really, really hard to not feel dehumanized in those moments. It's also about control and the lack of control in decision making. Sometimes the decisions about our health and our treatment are made without truly consulting us, and we don't fully get a say. Um, and you know, that's really hard. And sometimes it's because they're speaking over us or making those decisions or not informing us that there are other options available. Or in my case, sometimes I'm not able to advocate for my own health. Um, Due to one of my medical conditions, I have episodes of complete full body paralysis where I can either not speak or I cannot speak clearly or well or much. I can't communicate. Or sometimes I'm unconscious or in and out of consciousness. And I think one of the most frustrating things for me personally is when I cannot advocate for my own health. Recently, there was a medical episode where 911 had to be called because I was in a dangerous full body paralysis episode and I couldn't speak. And my mom, out of the goodness of her heart, was trying to help and, convey what was going on because she wanted to help me. But some of the things that she was saying weren't quite accurate for my condition or could actually make my treatment worse or more dangerous because they were just slightly off and I couldn't correct it. I couldn't fix it. I couldn't say what I needed to say. I could hardly get out or for yes and no. And that I felt like I couldn't do anything. I didn't have control. I didn't have that ability to have that own say in my medical care. And the emotional toll of all of that, the judgment from medical professionals, from strangers, the mistreatment from people, the loss of autonomy and independence and freedom, it really takes a serious emotional toll on somebody's mind. Because in addition to physical isolation, if you're too sick to, go out and participate in events, there's also emotional isolation, the lack of understanding and empathy that you can be surrounded with in your peer groups. It can be really, really isolating, and it's really, really hard to maintain relationships where people don't get it and don't understand. And it's really hard to advocate for yourself when you're constantly fighting not only your health but to be seen as human. And all the comments that people say, you're too young to use a mobility aid, you're too young to be sick, you're too pretty to be sick, all of that, it can become internalized, and we can internalize you're just being lazy, you're not trying hard enough. And then you can start to believe that you're less than. You can start to believe that you're not doing enough, that you're maybe you really are just lazy. Maybe you really aren't trying hard enough. Maybe you are too young to use a mobility aid. And you can start to believe that you're less than everybody else because that's how society treats you. And undoing that mindset and continually reminding yourself that you do have self-worth, that you are valuable, that you are worth it, and that your struggles are valid. Undoing that mindset is a battle in and of itself, on top of battling the medical system, on top of advocating for yourself, and on top of fighting the symptoms that your disease gives you every single day. You're not just fighting against your body to survive, you're fighting against your mind as well. So, where do we go from here? Where do we go to keep our mindset in the right place, to advocate for ourselves? How do we reclaim our humanity and autonomy in a world where it's so easily stripped away with these illnesses? It starts with conversations like this one, with building community with other people who get it, with finding resources on how to advocate and how to communicate these things. By sharing our stories, we can remind ourselves and remind others that we're not alone. There's other people in this, and we're certainly not less than anybody else. If you have felt dehumanized by medical professionals, by traumatic procedures and tests, by random people in your community, by your family, I want you to know that your experiences are valid. Your pain is real, and your worth is immeasurable. You are worth it, and your medical conditions don't change that. In fact, your medical conditions just prove how strong you really are. Until next time, take care of yourselves, and remember, you are more than your illness. You are human, you are enough, and to keep living rare. Once again, this is your host, Giusiana. Thank you for joining me on today's episode of Rare Living. I hope today's conversation left you feeling a little bit more informed, understood, and hopeful for the future. Life with a rare disease can be lonely, but no matter where you are on your journey, you're not alone. If you enjoyed this episode, please subscribe, leave a review, or share it with someone who might need it. You can also connect with me on my socials to continue the conversation or find resources that might help you. Until next time, take care and keep living rare.